Okay, so good afternoon, everyone.
Good afternoon, Miss.
Good afternoon, Miss.
Thank you. Today we will see about. Yesterday we talked about this rehabilitation for clavicular fracture, right? So around shoulder, whatever the fracture is, like proximal humerus fracture or mid shaft fracture or supracondylar fracture, whatever it is, we need to have that guidelines, right? That is the timing, the time frame, and some restrictions. So that is some precautions we need to. For example, what I am saying is. A clavicular fracture. If it is a clavicular fracture, in the initial period or initial weeks, we need to avoid overhead abduction or overhead flexion. That is more than 110. It should be avoided. Okay, so for each and every fracture, we have some restrictions that need to be followed. That is very important, right? So the clavicular fracture, the first thing is the restriction is beyond 110 degree. That is shoulder overhead abduction should be avoided. And for proximal humerus fracture, so the proximal humerus fracture, once again. Yes, and proximal humerus fracture, avoid internal and external rotation of the shoulder, right? So the maximum internal and external rotation of the shoulder should be strictly avoided in the for first 4 weeks. Okay, for first 4 weeks, we need to avoid internal and external rotation of the shoulder. And other than that, everything is we can follow. And the other thing is the mid shaft fracture. So mid shaft fracture, it is more safe compared to other fractures. Mid shaft fractures are safe. So what is the precaution means? Don't lift anything till 6 weeks. Till 6 weeks, we don't have to lift any weight. That is the only precaution. Other than that, we can safely do all the range of motion, active and active assistive range of motions. You can freely do that. Okay, and then supracondylar fracture. For supracondylar fractures, and for supracondylar fracture also, no passive range. Just note it down. No passive range of motion to elbow. Elbow also restricted, and then no internal and external rotation of the shoulder. Okay, so these are the various precautions you need to follow in the proximal fractures. So the clavicle overhead abduction, overhead flexion is avoided. And then for proximal humerus fracture, no rotations, no medial and lateral rotation. And one more thing is if there is any soft tissue, that is the rotator cuff injury. Along with that, the proximal humerus fracture, if you have rotator cuff injuries, avoid active movements. Only the passive thing is allowed. Okay, this is also one of the precautions you have in proximal humerus fracture. After that, in the mid shaft fracture, I already told you, anything is possible, only the lifting. Don't ask them to lift any body weight like that. And then for supracondylar fractures, no internal or external rotation of the shoulder, and then no passive range of motion to elbow, because you have one more problem called the myositis ossificans. There is a greater chance for by development of myositis ossificans if you apply passive movements or some kind of passive forces. Always gentle active movements are always encourageable in the distal distal third or elbow joint fractures. All the elbow joint fractures, you need to be like no passive movements or allowed. So okay, so this is what we have for from clavicle to supracondylar fractures. Now, now let's move on to the other than that, you just follow the protocol for whatever it is, like which week, which one is safe. We already have that protocol, just follow that. And prior to that, I will give you some details. What are the shoulder assisted exercise? What are the shoulder passive exercise? If you know that, you can apply it in all the shoulder joint problems, all the shoulder joint rehabilitation. The thing is same. Okay, the exercises are same, but the precautions I already told you. These are the restrictions you have. Other than that, we are safe to follow all types of exercises. Okay. This is for only for specific important joints. I explain in detail about all the active assisted exercise, passive exercise, because it's not a new thing to you all. Already you are familiar with that. We have Caroline Kistner, all the fundamental exercises. This is not exercise therapy. It is a basic MSK one. Actually, we need to talk about fracture. But to refresh that, because blankly we say passive exercise, active exercise means maybe you get confused. That's why for a few topics I added this. Likewise, you also prepare for other joints. Okay. And one more thing is, I told you, right, for the first week or first 2 weeks, the pain control. Pain is a severe problem, and then strict immobilization. Apart from exercises, you need to be in immobilization, that is any sling or whatever it is. And other than that, so the first week is scheduled for pain control and immobilization. Yesterday itself we talked. And the last phase, that is after 6 weeks, you need to go for the strengthening program is very, very important. Let's see what are the important muscles we need to strengthen. Okay, so the first week is for pain control and immobilization, and last phase is for muscle strengthening and functional activities, strengthening to functional activities, whatever they are needed. For example, some people may have some task they need to complete, like sports field. If the person is going to any sports event, we need to fasten up our rehabilitation program to match that, match him to that level of fitness. So like that, we can improvise. The last phase is purely for this strengthening program, and then stretching. You can allot it to stretching also, because in few degrees you cannot achieve it with passive exercises, active exercise, active assisted exercise. In that case, we need to do some stretching, some forceful stretching. That is all. We need to delay it till that safe period, that is minimum protection phase. The first one is maximum protection phase, and then the moderate, the middle one is the moderate protection phase, and then last one is the minimum protection phase. In that thing only you can have all the rehabilitation processes can be, we can freely start. Okay, so here we are talking about the shoulder dislocation, right? The shoulder dislocation cases. We have most common one is anterior dislocation, right? So for that, I will tell you the rehabilitation protocol. We have some confusions, right? How long the sling needs to be applied, how long the patient needs to be immobilized. So for that, I will tell you, it's depending on the age. The immobilization duration is decided by the age of the patient. So you can see that why it is different here compared to other things. Here 3 to 4 weeks for less than 20 years, because the activity level is high. In this group of people greater than 20 years and 20 to 30 years old, this group of people are what to say, they are more active, so there is a recurrence, there is a chance for recurrence is high probability we have. Sorry. So if it is greater than 20 years means complete sling immobilization can be given for 3 to 4 weeks, and 20 to 30 years 2 to 3 weeks, and greater than 30 years means just 2 weeks, 10 days to 2 weeks is enough, and greater than 40 years 3 to 5 days after dislocation you can remove the sling application. Okay, and during how to say, during exercise only they need to remove the sling, and after that during sleep and all the other activities they need to be in sling application. Okay, this is for shoulder dislocation, shoulder subluxation and dislocation. Because why we need to have this kind of thing means that to avoid recurrences. Okay, now we have like the first week, 0 to 2 weeks. That's why I told you this is for this group, 2 weeks to these people, not for younger ones. Okay, this phase is not for elderly, not for younger group. We start from second week itself, we start means the older group people. So begin with Codman film. All the shoulder joint problems, you start with pendular exercises. So that is the first thing you need to start. And then passive range of motion exercises, active assisted range, active range of motion exercise. All the things can be started to the shoulder joint aspect. That is flexion, extension, abduction, adduction, internal rotation, external rotation. Everything can be started either passively or actively. Either way you can choose. But one thing is, the only precaution you need to have in shoulder dislocation is avoid the provocative movements. For anterior dislocation, we all know that that is abduction 90-degree, external rotation and extension. That is while throwing. While throwing, you have this provocative movement. This is the least stable position. That is your head of humerus may dislocate anteriorly. So this provocative movement should be avoided. Maybe how to say that? Don't combine these three movements, and all the activities that need that kind of combination also should be avoided for the course of 6 months. 6 months, they strictly need to avoid this three movements: abduction 90-degree, and then external rotation and extension. This is, can you see that when you do that movement, it will going to be anteriorly, you feel the head of humerus more anterior. So already there is a weakness of capsule or ligaments or very lax means it will easily dislocate. So that's why 6 months of this provocative measure is avoided. And elbow range of motion also you can start in the shoulder dislocation program, like from passive to active movements. Okay, let's see what are the passive range, what is active assisted range of motion exercise, what is active exercises in the shoulder joint. Okay, we already know that in the clavicle fracture also we have these pendular exercises. So make clockwise, anti-clockwise, and then flexion movements, extension movements, and circular movements. All the things you can start do it in this way. And then the passive range of motion exercises. Passive means there is no contribution from the patient side. Only the therapist or the caregivers should mobilize or should perform the movement. So this is for flexion, abduction. Okay. And then this is external rotation, arm by the side, or abduction 90-degree and external rotation. And then horizontal adduction. avoid abduction for first 2 to 3 days, because they have fear. They have fear of movement also, and this thing should also be avoided in the early stage. Okay, because this is somewhat kind of provocative movement. Okay, so don't use combinations. That's what I'm saying. And then the active assisted range of motion. So that is passive, and then you can start active assisted range of motion.
Interlock hands and use your unaffected arm to assist raising your arms upwards.
Close.
Hands and use your unaffected arm to assist raising your arms upwards.
Oh, yeah. Okay.
To assist raising your arms upwards. Interlock hands and using your unaffected arm, assist the lifting of your arms upwards. With elbows against your body and bent at a right angle, hold a stick with palms facing upwards and move the stick to the affected side so your forearm moves outwards. Place affected hand behind your back and reach towards your opposite buttock. Grasp with unaffected hand and assist the movement up your back. Holding a walking stick or broom, push the affected arm out towards the side. Standing with one foot in front of the other, facing a wall or a closed door, place hands on a towel and slide hands upwards till you feel a stretch. Standing with one foot in front of the other, roll the ball across the table. Stand sideways and roll the ball across the table. Place your hands on the table and step backwards, leaning your chest downwards towards the floor until you feel a stretch in your shoulders.
But one thing is, the pain is the limit. Okay, don't whatever it is, whether assistive, passive, or active exercises, but just respect the pain barrier and then stop the movement accordingly. So in the first few weeks, you can't expect that it will reach the full ranges. Okay, so we have to gradually improve for the whatever is available. Be gentle in the first few weeks, and then we can increase it. In the middle phase, that is the moderate protection phase, we can extend our range of motion to the next few degrees. Okay. Okay, so active assisted exercise, or whatever the towel roll, using a towel or this kind of band, anything can be used for active or other limb. You can use other limb also. And the passive assisted means like therapist. Therapist can assist them in completing the movement. That is called the passive assisted. Active assisted is the patient by himself using band, towel, or other limb. He can assist, or sometimes we can use manual also. Manual help can also be given for completing the range. Okay, after that, active exercises. So for active exercise means simply all the movements without any help, or whatever the available ranges, you can perform active as shoulder flexion, shoulder extension, abduction, adduction, and internal rotation, external rotation. So this is what we can gradually increase in the following weeks. Next thing is muscle strengthening in the first weeks. Like if he's elderly, like 30 plus, means you can start the muscle strengthening also. Because for all the shoulder joint rehabilitation, just remember that without completing the muscle strengthening, you cannot achieve perfect results. This is very like I'm telling you, 100% results you can achieve only completing this muscle strengthening. It's very important, but the stage is different. Maybe in some conditions you need to start earlier, or in some cases you need to start it little later. Maybe that the protocol, the guidelines and the date of starting can vary from person to person, but at the end, in the last phase, they need to strengthen their muscle, both rotator cuff muscles as well as this scapular stabilizer. These two scapular muscles and rotator cuff muscles are very, very important, that we need to concentrate on any type of problems. You need to strengthen this muscle. That's why I given you a highlights. This is a strengthening program we have, and it can be matched with different conditions. Okay, so here for scapular stabilizer strengthening program can be started in the first week itself. But most of the shoulder fractures, you need to extend it after 6 weeks. Okay, so most of the time we extend it, or if it is more stable or more undisplaced fractures, means we can start little earlier also. So scapular retraction, protraction, depression, and elevation, you need to give the strengthening, but it is a closed chain. So closed chain strengthening exercise means your distal aspect should be fixed to the wall or floor. That is what we call closed chain. And then next thing is rotator cuff strengthening, but start it with isometrics. Isometrics is very important. Okay, so let's see this what is closed chain scapular strengthening.
Hi, my name is Dang Lee, and today we'll be doing closed chain strengthening scapula. So first, our patient in the quadruped position, and then protract the shoulders to go into the cat-cow position. Just so round his back basically, and then just lift and flex the arm up and work on flexing it. And yep, so he's essentially doing is protracting that shoulder while still moving it and getting that closed chain strengthening. And then next, what we have to do is get the yoga ball and essentially assume the push-up position on top of the yoga ball, and then just go down to and do a push-up, and then coming up, protract your shoulders again, just like before. So like the push-up plus, but
So this closed chain scapular strengthening is very, very important because it is safe to practice also, because why we prefer in the initial weeks closed chain means we are not targeting the specific groups. Okay, whole muscles, whole upper limb muscles are going to be activated. So it is not a burden or strain to your specific muscle. Okay, so everything gets strengthened. Along with that, your weak muscles also going to be stabilized. So that is the advantage of this scapular closed chain strengthening exercise. At the earlier time, like in the modern maximum risk periods, where we can start this.
hello
And,
everyone, this is Paul from Ortho
this
Eval
is-
Pal, and today I want to do a little
This
demonstration.
is also a few of the scapular stability exercise. And one more thing is they are using dumbbells. If sometimes in the early stage you avoid dumbbells, just the movement itself is enough.
On how to start some beginner exercises for scapular stabilization. Okay, these are going to be real simple, real easy. So if you're just getting at this for the first time, this should be doable. Okay, now if you've had any shoulder injuries, you want to make sure that you talk to your doctor about doing some of these activities first. Okay, so the first thing we are going to do is going to be a simple scapular retraction. So what you're going to do is you're going to squeeze the shoulder blades together and bring them down at the same time. Okay, and you hold for about 3 seconds and then relax. And squeeze together and down at the same time and relax. So you could do about 10 to 15 of those. That would be a good start for something like that. Okay, the next one is going to be a modified, kind of almost like a push-up. So you're going to be on all fours. And the idea here is to lock out the arms, make sure they stay nice and straight, and you're going to take the chest and push the chest up toward the ceiling and back down. But notice the arms stay straight. We're not letting them bend. Okay, what this is doing is it's helping to stabilize those muscles inside the shoulder blades to help to hold them up against the thoracic cage. All right, so again, 10 to 15 repetitions of those is a good start. Nice and easy, nice and slow and controlled. Good. Now the next one, you'll be laying right up against the table here. This is called the serratus punch. You can use a small weight to start with, okay? And it's important that you do this in an inclined position here, okay? Because it will activate the muscle on the inside of that shoulder blade better. So what you're doing is you're taking the weight, pushing it straight up toward the ceiling, and then back down and back up. And I'm going to let go now. Just like that. So it's more than just a 90-degree angle. It's going to be up to there. There we go. Good. That activates this muscle called the serratus anterior better and works really, really well for that. All right. Super. The next one I like to do, which is also pretty simple, is called alphabet spelling. So we're going to have you right on your back. You're going to take this weight. You're going to push it up toward the ceiling, and you're going to hold this up position so that the shoulder stays up off the table. And you're going to do capital letters, A through Z. You can start without a weight, or you can start with a weight. But this helps that shoulder blade stabilize while the rest of the arm is working. Very nice exercise to work on. All right, now we're going to flip you over. I'm going to take your weight, and we're going to let this arm hang off the table on that side. And you're going to hold that weight. You're going to keep the arm nice and straight, I always tell people, imagine there's a tube around your arm and you don't want to touch the edges, okay? So you're going to be lifting that arm straight up like this. The whole idea is to take the shoulder blade and bring it to the spine. Okay, nice and controlled like that. Just like your arm would be inside of a tube and you don't want to touch the edges, so you're not bending the elbow. This is called scapular retraction. The next one, very similar to it, is called a row. So you're going to take this weight.
We can use water bottles or any low weights in the initial period. If you want to very minimal weights, you can start, or sometimes don't use it also. Whenever it's safe, we can start using the dumbbells and all. Otherwise, simply just do the movement.
And you're going to bring it up just like that, just like you're rowing. That involves the lats a little bit more. Good. Just like that. So that is going to be our beginners shoulder blade stabilization exercises. Be sure to stay tuned for our more intermediate exercises that will be coming up soon. Thanks.
Okay, so this two things are the first thing you start is a closed chain scapular strengthening exercise, that is in the prone lying and also in the push-up thing. And after that, you can progress to open chain strengthening exercise, that is dumbbells, TheraBands, or tubings, or any weights. It can be progressively, you can increase the resistance. This is for scapular muscle, that is the protractors, retractors, elevation, and depressors. All the muscles, all the four important muscles should be strengthened. And then we have this rotator cuff isometrics. So this is for external rotation. Just have a couch, towel roll or pillow, and then just arm is by the side and elbow flexed to 90 degrees, and then press it with the dorsum of the forearm and hand region. So that will give you external rotator strengthening. And after that, this is for abductors. Stand by the side of the wall and then just compress it. Compress using the lateral aspect of the patient's limb. This is for isomer without changing the limb. Just you have to compress it. Just pressing is enough. So this is for abductors, that is supraspinatus. The supraspinatus isometrics, you can start like this. And this is for infraspinatus and teres minor. And then this is for subscapularis, internal rotator. Just compress it using palm of your hand. Okay, thereby you are going to give isometrics to all the important muscles. And then not only that rotator cuff, so you have one more stabilizer, that is our biceps. The long head of biceps is also going to be one of the stabilizer. So you need to start the isometrics to that also. So this is for shoulder flexion isometrics. You can just compress or press your fist on the wall. These are excellent and basic one. Without rotator cuff strengthening, you cannot give better recovery. So that's it for first 2 weeks, 0 to 2 weeks. The same exercise can be progressed to all the shoulder joint problems, all the fracture, but the timing is important. We have schedule says that you can start isometrics, you can start strengthening program, you can start the progressive resisted exercise, means we can safely follow the same exercise for all the conditions. Okay, we have already guidelines, you can match it with that. Okay, now we have week 3 to 4 here for this the same thing, all the quadman pendular exercise, passive ranges, active assisted range of motion, active range of motion exercise. You can start it and you can progress it also. Maybe in the first 2 weeks, maybe it comes to 40° means now we can set the goal to 110 or 90. Like that, you can improve the range of motion to next level. Same thing, everything can be progressed also. That is, repetition can be increased. The number of sessions may be 3 to 5, and then the sets can maybe the 3 sets. You start with 1 set means improve it with 3 sets, and 3 sets, and 10 repetition. You can start with 5 and then gradually increase to 10, 15. Like that, we can. If it is like they feel less fatigue and less painful whenever they complete that 10 repetition, means it is a chance to progress it. Okay, but how we can find out? Maybe he is doing 10 repetition for maybe more than a week. Means you ask them about the feedback, how they feel after completing a 1 set, whether it is easy to finish it, or is it painful, or is there any discomfort, or if so, then maintain it for 10 reps. Or is it too easy for them? In the beginning, they may struggle, and in the maybe after the end of the week, they feel it's so easy for them, means maybe we can increase the repetition to from 10 to 20. So always start it with 2 to 3 sets, safe 2 to 3 sets and 10 repetition and 5-second hold. And we can gradually increase that level also. So week 4 to 8 also the same things, all the range of motion exercises, and then resisted exercise also. Along with that, we need to concentrate on more of open chain exercises. Initially, we talked about more closed chain. Right now, we can open to dumbbells, TheraBand, and like other higher weights. You can go for more weight increase, maybe 200 grams or 300 grams or 500 grams. Like that, you can increase the weightings also. So all the open chain strengthening exercise can be given. And then deltoid strengthening. You can start the deltoid strengthening also in this week. So we'll see what are the open chain strengthening program.
In this video, we're going to go over rotator cuff strengthening using a resistance band. Now we're going to go through 3 different positions and 6 exercises in total. The first 3 are for external rotation of the shoulder. The next 3 are for internal rotation of the shoulder. Now I'm going to be performing 10 repetitions in each of those positions so you can follow along at home. Let's get started. For the first exercise, what we're going to do is start in a standing position. The upper arm is going to be parallel with the torso going down, and you're going to keep the upper arm tucked against your side. And the starting position is going to be the hands going to be right in front of the belly button. You're going to grab the band, rotate out as far as you can, and then come all the way back in. Now, a couple pointers. You want to make sure that you're only rotating the upper arm. You're not coming off the torso. You're not coming in front of the torso. It's just a nice, stable motion of just rotation. The other thing you want to pay attention to is your shoulder blade. You want to keep the shoulder blade back and down, engaged against your spine, and you're going to rotate the arm outward as far as you can from that position. So let's get started. We do 10 repetitions. Ready and go. 1, 2, 3, 4, 5. Nice and slow repetitions. And 10. Okay, now we're going to go into the next position. For the next position, we're going to bring the upper arm in front of us, 90 degrees at the torso, and the upper arm is perpendicular to our body. Now from this position, we're going to grab the band, and we're going to rotate back as far as we can. Now we're going to keep just the rotation as the main motion, and we're going to keep that shoulder blade nice and engaged in the back. So we have good stability coming from the shoulder blade through the shoulder joint. So let's start. 1, 2, 3, 4, 5. Just the motion from the upper arm. Feeling a good contraction on the back side of the shoulder. 8, 9, 10. Good. Now, final position for external rotation, you're going to bring the upper arm up to 90 degrees of abduction, and you're going to keep the upper arm stable, shoulder blade engaged against the rib cage and spine. And in this motion, you're going to start.
This is one of the provocative movements, right? Abduction and external rotation. So you can avoid it. You can avoid this type of thing. External rotation and abduction.
3. No extra motion. Good. So after going through those 3
I'm
positions,
telling you for dislocation case, this is little bit worrying
feel a nice
exercise.
burn into that shoulder, into those external rotator cuff muscles. Now we're going to work the internal rotator muscle, the subscapularis. So we're going to go through the same 3 positions we did in the previous exercises. So the first one, we're going to start with the upper arm tucked against our torso. Upper arm is straight up and down with the torso. No extra motions. It's only rotation coming in towards the belly button this time. So you're going to start out as far as you can with your range of motion, and then you're going to bring it in towards the belly button. So let's get started. Starting with the arm out, and you're going to rotate in towards the belly button. 1, 2, 3, 4, 5. Also keeping that shoulder blade folded into the rib cage or the spine. 7, 8, 9, and 10. Good. Second position for internal rotation, we're going to bring that upper arm in front of us, 90 degrees at the torso. We're going to keep the upper arm perpendicular to our shoulders. And we're going to start by grabbing onto the band in external rotation as far as we can. Bring it in to full internal rotation, only working that rotation of the upper arm. Now, grab the band, start with it externally rotated, and you're going to keep your shoulder blade engaged, so pull it a little bit towards your spine against those ribs. And let's start. 1, 2, 3, 4, 5, 6. Nice and slow with the motion, filling those shoulder muscles over. 9, 10. Good. For the final position, we're going to bring the upper arm 90 degrees into abduction, and we're going to hold that arm parallel with the shoulders. We're going to start by grabbing the band in an external rotated position, and we're going to bring it all the way into internal rotation, just working on that rotation of the upper arm. Before you start, engage the shoulder blade, pull it towards the spine and against the ribs, hold it, and then bring the band down. 1, 2, 3, 4, 5. Really focus on only rotating through the upper arm. 9, 10. All right. Just made it through the 6 exercises for the rotator cuff. Now, if you
So the same way here he's doing with tubing, right? In the same way you can do it with dumbbells, TheraBand, or you can use overhead pulleys. Weights and overhead pulleys can also be used. Anything Along with that, you can gradually progress it also. The TheraBands, we have different color bands for different strengthening program, started from easy level to more stretchable kind of thing. Okay, so this is what we can have for rotator cuff open chain strengthening program.
Who are looking to do on both sides.
So this is for scapular muscle, that is our depressors, protractors, retractors, and elevators. That is also we can give a strengthening exercises for all the scapular muscles. That is all the usage of dumbbells, TheraBand, everything is for a minimum protection phase. Okay, that is in the maybe crossing a safe zone. They need to be like more stable or fully healed. That kind of period where you start this open chain exercises. Okay.
Hi, I'm Dr. Matthew Bose, and welcome to our video series. Proper therapy exercises are important for recovery from most orthopedic conditions. I've designed this series to provide you with up-to-date therapy regimens that you can access at home, in the gym, or on the road. I hope you find these videos helpful, and best of luck in your recovery. In this phase, scapular strengthening progresses with a light dumbbell. Elevate the side, feel the shoulder blade hiking up on your shoulder. Hold that position for a 1 or 2 count to strengthen the scapular elevators, the muscles that stabilize your shoulder. Protraction exercises are done. Feeling that shoulder blade lift off the table. Start position flat on the table. It's often helpful to do both sides at the same time. Symmetrically lifting both shoulder blades off the table. Increasing the resistance as needed. A TheraBand can also be used. Traction exercises are done starting at shoulder level. Hands connected by a light band. Feel the shoulder blades pinch behind you. Hold that position. It's also done at waist level. Make sure to get all the muscles that stabilize the shoulder blade. Hold that fixed position.
Okay, after that, we can progress it. All the range of motion exercise and all the strengthening program can be increased. Maybe number of sets can be increased, or the therapy and difficulty level can be increased. And you can add up some biceps strengthening, supraspinatus, right? So, and then rhythmic stabilization, that is a PNF technique. One of the PNF techniques can also be started. And posterior capsule stretching. Posterior capsule stretching is nothing but horizontal adduction. You are giving some pressure to the horizontal adductor position. What I'm saying is, okay, so this is what we are saying, posterior shoulder capsule stretch. Or you can use this sleeper stretch also. This is what we call it, sleeper stretch. Yesterday I have shown you, right? So sleeper stretch or this posterior capsule stretch, either both are same. Okay, it's going to stretch your posterior capsule, and the posterior capsule is more prone to go for tightness. Okay. That's all about and functional strengthening. That is the work-related task. You can give strengthening to that specific task they are going to involve in. Okay, so that's it about your shoulder dislocation protocols. Okay, already you know that the space, the day in which you need to start, which is safe period, like that. I for each and every fracture, I have given you all the guidelines. Like that, you have to prepare. Okay, for assisted exercise, what are the things you need to, and for and for strengthening for around, for example, radial fracture. You take radial fracture, and the safe period is which day you need to start the range of motion, whether it is the passive is safe or active, like that you need to give. For I'm telling you for very few cases, very important conditions, but details, so much of details you need to prepare. Okay, use your use the Caroline Kessner and other Dina Gardiner. These books will give you all the exercises. Like that, now you get a clear idea, right? What is the strengthening program? What is isometrics? What is the progressive resisted exercise? So accordingly, you can make a to say that all the exercises. Okay, shall we go for this proximal humerus fracture, or maybe I think next week onwards, are you having study holidays or
They haven't mentioned anything.
pardon?
They haven't mentioned anything yet, miss.
Oh, okay. So this thing, maybe next week we will see it in detail about this proximal humerus fracture rehabilitation, or else same. This for shoulder joint, everything is same. Already we have discussed it, and in the upper limb fractures, right? In the upper limb fracture part one, in that we have protocol, which day you have to save, like 0 to 1 week, and then 2 to 4 weeks, like that. So accordingly, you can match this, the same strengthening program and passive exercises, assisted exercise can be matched to that type of fracture. Is it clear? What do you understand what I'm saying?
Yes, miss.
Yes, miss.
Okay, so what I'm saying is these are all the exercises. The same exercise you are going to do for all the shoulder joint fracture or all the shoulder joint rehabilitation, but the timing is different for different fractures. Okay, so maybe you have to follow that day 0 to day 1 to first week, what are the protocol, and then second week to fourth week, what is the guideline. Accordingly, you match that exercise. Okay, is it clear? For all the fracture, I have given you that guidelines, that protocol. Okay, the day 0 to first week. So match it with this thing. Okay, and then precautions. Important thing is remember the precautions. What is the do's and don'ts in each and every fracture? Okay, so I think we have completed the shoulder joint rehabilitation, and maybe next week or Tuesday. Okay, sorry, we're running out of time. Okay, so what I'm saying is next week Tuesday only 4 to 5, and then Wednesday also 4 to 5, and Thursday 2 to 4. Okay, so we have that time. So Tuesday I will meet you on Tuesday 4 to 5. let's wind up, guys. Thank you all for listening patiently. Okay, bye.
Thank you. That's
Thank you, Miss. Take care.
Same to you.
Thank you, Miss.